So I will digress and talk again about one of the questions that we received via our through the social media group was how are we doing in our quest for the Heil? The first thing is for 2020, we just narrowly missed out of the top. And as you know, we strive, and safety is one of our core values. We strive to win the Heil Trophy every year. And if we're a top contender, then that means we're doing our job and we're being safe out there. So that's great. I want to tell you that we're on track for 2021. We actually have a 15% decrease in the number of preventable DOTs. So that's a really good improvement from last year. And I want to encourage you all to keep up the good work. We have had an increase in lane change and run under accidents. And so I just want to remind everyone to make sure you're keeping your safety box around you. Look and monitor vehicles that are passing you and merging. So keep an eye on that. Our SmartDrive scores are continuing to improve, which is fantastic. We're down to 31 this week from a range of 48 back in January. So kudos to all of you for keeping on top of that and continuing to drive in a safe manner. We really appreciate it. You guys are the professionals out there, so thank you. And last, around the safety, remember that we're back to school now, so be on the lookout for school zones and buses and kids running in and out of traffic. So again, thanks for all you do for our safety efforts. A few other things I wanted to hit on this evening. Our health plan gets a lot of questions, and health insurance in general can be a confusing topic. So first and foremost, I want to remind you that in Workday, we have a worklet on there that's known as Benefits Info. And in that benefits info is a myriad of materials, videos to help you be a better consumer of your health care. So I encourage you to look at those. In addition to being in Workday, they're also in the benefits section of our mobile app. So on your GT mobile app, if you look in your menu under benefits, you'll see a myriad of items available to you for review. We are constantly, as senior leadership, we are constantly looking at our plan design. We have a number of experts, consultants, nationwide consultants that are very good at what they do. They are experts at what they do, and they help assist us in plan design and trying to keep our premiums low. We just received the benchmark survey from Cottingham and Butler that shows that our premiums are at an industry low compared to other trucking companies. And I think that's really exciting because what that means is there's more money in your pocket. So more plans are coming. We'll have a few plan changes, a few minor ones coming up for the open enrollment. And so be on the lookout for that. That'll be coming to you in November. So more information to come as we continue to flesh that out for the end of the year. Another thing I wanted to talk about is this current labor market that we find ourselves in. We're having a really hard time finding drivers, and it's just because, well, there's a myriad of reasons. But I can tell you it's getting harder and harder to find employees in general. And this just isn't in trucking. This is in all labor markets. So in hospitality, in retail, employers are having a really hard time finding employees. And we are too. So I want to remind you all that we have our referral program that is available to you. If you want to recruit a driver for Groendyke, there's some extra cash in your pocket to do that. Additionally, we're working on some hiring events in some of our areas, trying to get the word out that we're looking for drivers. We have plenty of work in order to get these drivers on the road. So I encourage you to tell your friends and family members to check out Groendyke as a good way to start their career in trucking. And last but not least, I don't want to, but I have to, I guess, talk about COVID. And trust me, I am so sick of talking about COVID. We did reinstate our mask mandate, and that is primarily due to the Delta variant that is taking off across the country. Hospitalizations are up significantly, but it's important to remember that 93% of those hospitalizations are the unvaccinated. So I highly encourage you to get vaccinated, not only for your own safety, but for the safety of your loved ones and your coworkers as well. We don't want to miss time with work. So make sure that you are taking care of yourself, staying healthy. Remember your good hygiene practices that we've talked about for over a year and a half now. And just remember to be safe, social distance, and wear your masks. So that's all that I really wanted to cover this evening. I'm going to check to see if we have any questions or comments coming in. I'm being told no, which I find very sad. I'm hoping maybe some of my friends out there might want to ask me a question. I mean, here I am, ready to answer your questions if anyone wants to throw something out there to me.
Insurance? Can you talk a little bit more about insurance?
Insurance in general. So I can be very vague about insurance. It's a big topic. So is there something more specific around insurance? I think it's important to remember knowing how to use our plan is really important. So the health savings account is your best friend. If you can invest pre-tax dollars into your health savings account, remember that is money that you can keep forever and ever, and it will roll over year after year. So it's different from a flex spending account. If you'll remember that you have to try to use up by the end of the plan year. The difference with a health savings account is if you are relatively healthy and you don't have a lot of claims, you have an opportunity to really build up that health savings account. And it can even be used once you get into retirement as another form of retirement savings because you'll be able to use it for Medicare expenses. So I highly encourage you, if you're not already contributing to the health savings account, that you need to do that as well. And then, of course, there's an employer contribution that Groendyke will kick in, dependent upon your tenure. Will depend on how much we contribute to your HSA. So again, it's free money to you if you're just contributing, and it can roll over and you can keep it forever, even if you leave Groendyke, which we don't want you to do. But it's money that can roll over and can be used for any medical expenses going forward. Great questions. I might even consider doing a more robust, once open enrollment gets closer, we may consider doing a let's talk maybe with myself and Rebecca Schmidt, our benefits manager, to go into more detail about the changes coming for the plan year 2022. So great question on insurance. Anything else?
We have one asking if at any point we will mandate the vaccine.
Great question. The question is if at any point we are going to mandate the vaccine. I will say that we're unknown at this time. It's not something that we want to enforce at this time. It is great news that the Pfizer vaccine has been approved by the FDA, and it is my suspicion that Moderna will follow shortly thereafter. So we are starting to see many large employers, Walt Disney, the Walt Disney World, Delta Airlines just came out with a mandate as well. So we're not quite to that point, but it is something that we may consider in the future because it really has been proven that vaccines are working. So more to come on that as it develops.
Just got one other. There are people wanting a reminder on the fact that Health Check 360 lifestyle points are due.
That is absolutely a great point. So remember that to get the best use out of our plan is to join our wellness program. And we do have the Health Check 360 Wellness Rewards deadline is coming up next week on the 31st of August. So make sure you're tracking your lifestyle rewards, that you've submitted your all of your documentation through the mobile app or online, and you should have already done your health screening by now and had your coaching call. So again, deadline for Health Check 360 is the 31st of August. So great questions coming in regarding insurance and our wellness program.
Somebody is asking if you can use the HSA even if you don't have health insurance through Groendyke.
So you can open your own health savings account without having insurance through Groendyke. So HSA Bank is its own standalone bank. They are partnered with us so that we can do the pre-tax payroll inputs or deposits into your account. If you wanted to go on your own to HSA Bank or another and open a health savings account, you're more than able to do that. The caveat, though, is that you have to be a member of an eligible health savings account plan, which means there is a certain deductible amount that is required. So you will have to, if you're on your spouse's insurance, you will have to check with them to see if they are an HSA eligible plan.
Do they require masks and training?
Masks, well, yes, masks are required for Groendyke everywhere unless you can socially distance. So if you are training and you are in a truck with a trainer, you should be wearing a mask. Great question. Any more?
What about the vaccinations for the South African drivers? Is that something we will require or available?
So great question. We are considering hiring some foreign drivers to help fill this gap and this need that we have. And yes, I believe it will be a requirement of the United States when they get their visas that they are vaccinated. Good questions. Another one?
So when customers mandate vaccines and ask us what we plan to do, how should we respond? They may block non-vaccinated people.
Yeah, that's a great point. So, you know, it's possible that some of our customers that we deliver to might mandate vaccines. And so that's something we're going to consider in trying to determine whether or not we do so as a company with Groendyke. So it's important to note we're not just looking at the safety of our people, which of course is number one, but it's also what is going to be required by our customers. Many of you drivers out there have already experienced having to have your temperature taken or put a mask on when you enter some customer facilities. So it's quite possible that some of these larger customers that we have may be mandating that the people that enter their facilities will be vaccinated. So we'll be keeping an eye on that and keep you informed.
Are drivers with 1 year of experience welcome in the Fort Worth area?
Drivers with 1 year experience are welcome in the Fort Worth area, and we'd be happy to have you apply if you haven't already. Certainly, we're looking for an experienced tank truck driver, but we're willing, if with a good MVR and you're a safe driver, we're more than happy to take you through the interview process. So please apply.
Couple more here for you.
A few more questions. This is exciting.
This is an easy one. Any vacancies for drivers from Africa, Zimbabwe?
So good question. The only country that we're currently sponsoring right now is South Africa because we're working with an agency over there that's going to help us with the visa application. So I am in talks with some of our state government as well as using national tank truck carriers as a lobbying group to help us figure out ways in which we can hire more drivers. And I don't just mean foreign drivers, but I mean, how do we open up the funnel to get more people into our industry? There are a lot of barriers, as most of you know, that are drivers. There are a lot of barriers to trying to get your CDL, your hazmat, a TWIC. You have to be at least 23 years of age from an insurance standpoint. If you're not over the age of 21, you can't drive interstate. So there's a lot of regulatory barriers that keep people from wanting to enter into our industry. Not to mention the lifestyle. The work that you all do is extremely important, and it's not easy, and we understand that. And so it's important that we find an avenue that is easier for people to want to come into our industry. I mentioned the labor market earlier. You know, we have increased pay more than 30% in the last 5 years, and we're continuing to pilot more models and how we pay and how we pay differently. So this crunch that we're experiencing isn't all related to pay, but it's also related to the regulatory issues that we're finding that become a hindrance to trying to hire more drivers. So we're in talk with the folks in DC. I don't know how much we'll be able to push the needle, but we're certainly getting the right heads to nod and to listen to what we're saying. So more to come on that too. I'm excited.
Got one more here.
Sure.
If we have employees in local terminals who are against getting the vaccine, whether they've gotten sick or not, how do we encourage them to get the vaccine without making them feel offended or singled out by comments they might make about it?
So, can I read that back? Can they hear you? Do you know if they can hear Matt or not?
They should be able to.
Let me just.
Go ahead and read
This
that
is
one.
this is a great question. If we have employees in local terminals who are against vaccine, and if they've gotten sick or not, how do we keep encouraging them without making them feel offended or singled out by comments they might make about it? So let me tell you the law around COVID, first of all. You can absolutely ask if someone has been vaccinated. You cannot ask them why they haven't been vaccinated. Now, if we decide to mandate, we can ask them why, because there are medical exemptions, of course. But that is something that should strictly go through the talent office, not handled by local management. So the only thing that I can say about encouraging people to get the vaccine is to consider and continue to show them the statistics around the vaccine is working. I think that our politics have really made this a political issue when it's not. The science is there, and the science proves that the vaccine is working. So all we can do is continue to encourage, and then if at some point we do have to mandate, then we'll handle those on a case-by-case basis. So as the CDC says now, everyone should be wearing a mask again, regardless of vaccination status. So there shouldn't be this feeling of who has and who hasn't. Like, we want to make sure we're not pitting people against each other, because that's certainly not what we're trying to do. Our first and foremost thought is the health and well-being of our people. So just encourage them to continue to get vaccines, and we'll take it on a case-by-case basis, because as you all know, and we've all been through the last year and a half, this changes almost on a weekly basis. So keep an eye out, and we'll continue to keep you informed. You can always come back to Groendyke or come back to the talent office to be the voice of reason, to cut through all the rhetoric, and to try to get to the truth about what's out there and what the CDC says. And we're going to continue to go by CDC guidelines from here on out, as we have since the beginning. Great questions.
So here's one. Do you hire convicted felons?
Do we hire convicted felons? That's a great question. So the short answer is no, but there's a longer answer. There are certain offenses that we're not able to hire because of the Patriot Act and whether or not that person or individual would be able to receive a hazmat endorsement. So in those instances, we don't. People that were maybe incarcerated 20 years ago and had something, in their youth maybe that happened, we look at those on a case-by-case basis. Anybody that's been incarcerated in the last 5 years would not be eligible for hire at Groendyke. So the answer is yes and no, if that makes sense. It's on a case-by-case basis. There are certain offenses that if you want to know what they are, reach out to the talent office, but there are certain offenses that we will never be able to hire for. But we do look at those that are in a much larger time frame. We do look at those as a possibility. So, good question.
I have one
The-
more here. The person asking, will Groendyke terminate my employment if I don't renew my hazmat endorsement?
Will Groendyke terminate my employment if I don't have my hazmat endorsement? So it depends on what you're hauling. So obviously there are products that we haul, although very few and far between, but there are products that we haul that don't require the hazmat. So it will depend on your location. But I will tell you the majority of what we're hauling are hazardous materials. So I would encourage you to renew your hazmat. Of course, Groendyke will help pay for that. So if you need to retake the test, you specifically, if you want to reach out to someone in the talent office, we could kind of walk you through what the steps are to renew that and to do that. So be very careful about letting your hazmat expire before it does, so that we can take a look at it. But 9 times out of 10, you're going to be required to have your hazmat. These are Fantastic questions. One more.
I'm going to let you look at that and
So this is a great response, and I'm just going to read it here. Mr. Hodgen is talking about the question regarding employees refusing to get vaccinated. Obviously, decisions have consequences, including if someone exercises the right not to get vaccinated. Continue to examine their reasons for not getting vaccinated. We don't typically inspect bridges, but we drive over them every day, right? We don't inspect airplanes, but we all travel by airplane. At some point, we have to trust that the experts know what they're doing. So I think that's a really important point to make. So again, I think it's a very personal choice, and having a one-on-one conversation with those individuals that have a fear and understanding where that fear is coming from, you may be able to get to the bottom of it. But that's what the talent office is here for, to be a resource for you. So thank you, Matt. To be a resource for you. So if you ever have questions about this or want to talk through it, please, I encourage you to call the talent office, and that's why we're here, is to help you out and be a resource. So I think that's gonna sum it up for this evening. I really appreciate everyone's input and questions. I really like that. So hopefully we will have another Let's Talk in about 3 or 4 more weeks. So stay tuned for that. And everyone, have a good evening. Bye-bye.